Well, good morning, everyone, and thank you for joining us this warm summer morning. I hope everyone is having an enjoyable and safe summer. I'd like to start once again, as usual, by recognizing an outstanding team member. And today I'd like to recognize Dr. Erin Reed Gigum, who received a $300,000 grant from the Bright Focus Foundation to support her work, developmental determinants of sexually divergent neuroinflammatory processes in Alzheimer's disease. Really outstanding that our faculty are continuing to garner grants to support the work and the research that they do to improve the delivery eventually of healthcare by understanding the mechanisms of disease. I also want to thank all of you who attended the town hall events over the past month, where I had the opportunity to share with you the results of our zero-based budget and our new budget for fiscal year 2022 that was approved by our Board of Trustees. Thank you really for your support. It was important for me to be able to share the results as well as many of the important university efforts that have been put forward to help support our faculty, our staff, and our students, and to continue to make Neomed a great place for all of you to be. This is a busy time on campus and will continue to become busier over the next 7 weeks. We have returned to campus in a much bigger way than we had in the past as we continue to watch the pandemic dwindle cautiously. And we've had an increased number of community members here in the new center space. We've also are returning to campus with our students at much bigger numbers than we have in the past, as we have had record enrollment this year. We currently have our class of 2025 M1 students joining us on campus this week for orientation, and we'll cap that week off with the white coat ceremony, celebrating their ascension into the medical field. Our College of Pharmacy class of 2025 P1 students will be joining us in early August, and the Biomed Academy is scheduled to begin classes on campus in mid-August. Added to that, Summa Healthcare will have their grand opening of the new healthcare services space on the Neomed campus on September 11th. We're expecting a significant increase in the traffic footprint of people on this campus for both education as well as those seeking medical care. I'd like to also show our incoming students what a great place Neomed is. We are all university diplomats. And when you see a new student on our campus, or even one of our older students who's rejoining us for the upcoming academic year, I encourage you all to say hello and to provide them a warm welcome. If they appear to be lost, please reach out and help provide that exceptional experience by directing them where they need to go, helping them get the assistance that they need. We always need to remember that they are the primary reason why we exist as a university. You should see increasing diversity on our campus. While we have always been an ethnically diverse campus, we have not always been diverse from an underrepresented minority perspective. Our incoming class in the College of Medicine this year is at about 30% underrepresented minority, and our College of Pharmacy will be at about 16%. I know that all of you will help make this a very special place for them and for them to feel very warm and very welcomed, as all of us value who they are as people and the impact that they will have in healthcare as they migrate through the great educational programs at our institution. I'd also like to offer a big thank you for all of those who came out to celebrate the LCME results with us last week. It was wonderful to get together in the quad, see the smiling faces of those who were vaccinated without masks, and to be able to recognize all of you for the great work you did that allowed us to achieve the outstanding results on the LCME site visit. So thank you again. We would not be able to do this without all of you. Your efforts and the impact were incredibly impressive. An update with COVID. more and more people are feeling that COVID may be working its way into our past. I ask that all of you continue to be vigilant and to do your part in keeping our campus very safe. While the numbers are down substantially across the state of Ohio, we are receiving information on an increased uptick over the past week or two that is likely the result of the Delta variant, which is more transmissible. And it's going to be mostly the impact of the Delta variant on those who are unvaccinated across our state. So please be vigilant. For those of you who are not vaccinated, we ask that you wear face coverings and continue to observe social distancing. We've had 0 cases of COVID-19 with our faculty, students, and staff over the past week, and we had 1 case the week prior to that. I'm very pleased to share that our campus is about 85% vaccinated overall. For those of you who are not, I encourage you to get vaccinated. We'll continue to follow safety procedures on our campus, targeted mostly at our unvaccinated population, to keep that population healthy and safe. We are adapting our COVID compliance policies slightly to the changing environment. While we'll continue to have no restrictions on fully vaccinated individuals on our campus, we have made some slight changes to the policies and procedures for those who have decided to go unvaccinated. For now, unvaccinated individuals will continue to be required to wear face coverings and socially distance indoors at the university, as well as in crowded outdoor settings. The main change is that instead of mandatory weekly testing for every unvaccinated individual, we will do random weekly mandatory testing for that group. We are also asking supervisors to enforce face covering and social distancing for our unvaccinated employees so that we can continue to maintain a safe work environment for them. A few weeks ago, I shared that Mr. Daniel Blaine had made the decision to move on to new horizons and to seek new challenges. I want to thank him for all that he accomplished to grow and support NeoMed while he served as the Vice President of Advancement and the President of the NeoMed Foundation. As you may know, I was able to recruit Mr. Lindsay Loftus to join us as a Senior Gifts Officer and also to serve as the Interim Vice President and President of the NeoMed Foundation, while I work with the NeoMed Foundation leadership to construct a recruitment strategy for a new Vice President of Advancement and President of the NeoMed Foundation. That search will likely occur in 6 to 8 months, as we are expecting a significant need for a time gap given the large number of positions available in the limited workforce currently seeking those positions across the United States. We are very fortunate to have Mr. Loftus join us. He's a known entity to the university, and he has had great impact in the past. He recently completed a master's degree in advancement activities and fundraising, so we'll likely all benefit from the knowledge and the expertise that he'll bring with us. A note to managers from our HR team: please ensure that all of you participate in the HR provided training related to the goals and alignment with the strategic plan. It's important that we participate in these types of training opportunities to ensure consistency among the NeoMed community. A reminder that this Wednesday is Whale Wednesday. I invite and encourage all of you to show your pride and enthusiasm for NeoMed by wearing NeoMed spirit wear and showing our incoming students and our current students our esprit de corps and our support for them. And finally, as a way to say thank you for your continued commitment and contributions, NeoMed wants you to take some time to relax and enjoy family and friends during the holiday season that will be coming up. The university will again be engaged in reduced operations for 2 weeks, beginning Monday, December 20th, and continue through Friday, December 31st. Neomed will resume full operations on January 3rd, 2022. During that period of time, we encourage employees to use 3 days of vacation or compensatory time if available, Monday, December 20th through Wednesday, December 22nd, which when combined with the approved 3 days of holiday leave and 4 days of winter break will give you a full 2 weeks off to relax and to enjoy your holiday period. With that, I'm going to stop and open it up for questions.
Yes, the first question is, did the state include money for a new dental school in the new budget?
The state did. They provided us $1 million beginning next fiscal year. Now, we are undergoing the process of getting our partners together who had requested us to start a dental school and using that $1 million to leverage fundraising to be able to put the dollars in place to kick off a dental school. So it really is going to depend on additional dollars coming in to match that, as well as the appropriate amount of clinical partners who had all asked us to do this, providing training opportunities for us.
Currently, there are no more questions in the Q&A.
I do see one that was submitted to me. It says, where can the formal grievances process be reviewed? I would suggest that you meet with HR as they are holding the policies relative to faculty and staff grievance processes. If it's a student, please make sure that you coordinate with, I believe that would be under the Associate Vice President for Academic Affairs. Great. Well, thank you for your time today.